Hey there, everyone. Welcome to another episode of From the Pit, a heavy medical consult. And as promised, I'm getting back to you with a little bit longer format on this whole mess that this administration is creating over Tylenol and autism. I decided to try not to waste too much time getting back to this. So let's just jump right in here. So as I mentioned in that kind of like brief thing before, this is a classic example of correlation, not causation. And I know I have, and I'm sure a lot of other people have bandied that phrase about. And to give you a better example of what we mean by that, if I haven't done so in the past, and that is, here's a real simple example, and that is the correlation between correlation between caffeine drinkers and lung cancer. And if you study this, you will see that a ton of people who drink coffee develop lung cancer. However, this is a correlation. This is not a causation, because it is confounded by the fact that most people who smoke also happen to drink coffee. It's a very common thing. And what the real causative issue here is, that tobacco smoking is the causative issue, not the caffeine. So that's what we mean by correlation versus causation. And the studies that they are trotting out here are really an example of that, Dave. They're trotting out a lot of observational studies, which on the list of research is at the lower end of high quality data. A lot of them are older studies. A lot of them have smaller sample size. Some of them are just poorly designed. And all it really shows is that there is a correlation. Now, here they are looking to or recommending that we do further studies on this because of such. However, those studies still exist. Really well done studies have been done. High quality research, large population-based studies, cohort studies with sibling controls, with sibling control analysis, meaning they use healthy siblings as a control. And these have all demonstrated that there is no causal relationship between Tylenol use and autism and ADHD and other neurodevelopmental disorders. It's all an issue, or that correlation is confounded by familial issues, genetic issues, environmental factors, not the use of Tylenol. And to suggest that there needs to be further research is, well, again, it's a little laughable because that research already exists. My bigger concern here is that they're using this as some kind of backdoor way to do research to try to promote some type of further misinformation when it comes to autism, which now that they are in control of this, now that they can control the data, that this is something that they might try and do. I'm not saying they're going to do it, but this is a big concern at this point because, again, the research regarding Tylenol, autism, and neurodevelopmental disorders is already there. Perhaps the most egregious and dangerous recommendations from this press conference was for them to say women should just tough it out when they have a fever during pregnancy. And I'm not exactly sure. I don't know really where to start with this, except for, well, maybe that Tylenol has just mountains of research and data that shows it's safe to use for minor aches and pains and fevers. And as I've just pointed out, there's very well designed research that shows there's no relationship or there's no causative relationship between Tylenol and neurodevelopmental disorders such as autism. But what is very well documented is the risk of not treating a fever during pregnancy. And this can lead to a host of issues. It can lead to what are called neural tube defects. And the neural tube basically is, in its simplistic form, what surrounds your spinal cord and brain. And this can lead to being underdeveloped, which can lead to anencephaly, which is basically failure of it to close around the cranium or around the brain. This can lead to absence of major portions of the brain and skull. At the other end, at the tail end, so to speak, it can lead to what's called spina bifida, which results from closure of the neural tube at that end, and can lead to spinal cord issues. It can lead to congenital heart issues. The most consistently reported ones are what are called ventricular or atrial septal defects. Basically, the wall between the chambers of the heart. It can lead to defects of the vessels that come off the heart, something called tetralogy of Fallot, which can lead to what's called blue baby syndrome, because their red blood cells are not getting properly oxygenated. And that requires very complex surgery to fix. And among many other congenital heart issues, it can lead to oral clefts, basically cleft lips, which can cause very significant issues as far as the development of the lips, the teeth, and the upper part of the palate, again requiring significant surgery. And untreated fever, guess what that can lead to? Can lead to neurodevelopmental issues. This is something that we know for certain can lead to things like autism, spectrum disorder, attention deficit disorder, and developmental delay. So while they're trying to say Tylenol causes this, and it doesn't, not treating fever can put you at risk for this. It can also lead to issues with the pregnancy itself. It can lead to premature delivery. It can lead to stillbirth. It can lead to low birth weight. It can also lead to a condition, if this happens during delivery, what's called hypoxemic ischemic encephalopathy. And this is basically the child, the fetus, the baby does not get enough oxygen to the brain. It causes death of sections of the brain, which can lead to any number of issues as far as like brain damage and developmental delay. So while Tylenol, there's no causative relationship with things like autism and other neurodevelopmental issues, not treating the fever, there's a whole host of risks. A close runner-up as far as misinformation or poor recommendations in the toughing it out phase of things is that even though they did make mention not to use ibuprofen, Advil, Motrin, and other NSAIDs, unfortunately, there's going to be a bunch of people who maybe either didn't hear that, maybe did not understand that, and don't already know this. But the only other option to treat fever is using things like ibuprofen, and this we know is something not to do during pregnancy, because actually, just like treating a fever, just like not treating the fever in pregnancy, if you use things like ibuprofen, Advil, Motrin, and other NSAIDs, that also has a whole host of risks to it as well. And that includes things like the premature noted cardiac congenital abnormalities. This can lead to something called oligohydramnios, which is basically a low amount of amniotic fluid during the pregnancy. And this can lead to things as far as poor perinatal outcomes, growth restrictions, low birth weight, and stillbirth. It can lead to neonatal renal impairment, kidney failure, basically. This can further lead to pulmonary hypertension. It can lead to limb retractions and delayed lung maturation. So, the concern here is, they're saying don't use Tylenol for fevers. And there's going to be a subset of people who either didn't hear the other part of the recommendations to not use NSAIDs, they're not going to understand it, or they may not understand it, and they're going to be looking for something to use, and they may use this when they shouldn't be. So this again puts pregnant women in a very precarious situation. Either don't treat the fever, which has a whole host of issues. Treat it with something you're not supposed to, which has a whole host of issues and complications. Or treat it with something that they're now scared to use because of a connection, an inappropriate connection that they have tried to highlight. Finally, I want to just briefly touch on this recommendation for folinic acid, or also known as leucovorin. And I want to stress here, this is not an all or none thing, okay? This is not that it can't be used, or not that there's some indication for it to use. There actually is. There are some studies that show it can improve some symptoms of autism, but it's in a very narrow group of patients, and it's a group of patients where they have an issue with folate metabolism. So again, this is very nuanced. This can be used in a very subsection, subpopulation of people with autism, but this cannot be used, or it's not really recommended to be used across the board. This is not a panacea. This is not a cure-all for autism. And one, they really did not properly present it that way. So there's going to be this misinformation, this misguided thought process that you can use this to treat and potentially cure autism. And that's just completely wrong on their part. Number two, there is a severe conflict of interest here, mostly because Dr. Oz, who is now part of this administration, owns a company that produces leucovorin, folinic acid. So this is a very obvious and it's very obvious financial conflict of interest here. And this is something that we as healthcare providers, we have to take education on this every year. You know, a lot of you out there know we have to do a lot of continuing education as far as our medical issue, or as far as our medical training is concerned. But I think what a lot of people don't know is every year we have to take a lot of required training, particularly when you work in a hospital, on things such as not taking financial kickbacks and making sure that you do not have a financial conflict of interest either in the hospital or with treatments you are recommending. And this is here. This is a clear-cut financial conflict of interest that for anybody else in the country who is in medicine would have to very much openly declare this before making any recommendations. So there's an issue here, and I don't think a lot of people are appreciating that. And again, I have no doubt he's going to see sales of this go up, and this is not something that can be used to treat everybody with autism. So major issue here as well. Okay, well, that's where I'm going to kind of end things right there. You could go into this in far more detail than I have. And listen, if you don't believe me, that's fine. But there are many other phenomenal science educators out there that are going to tell you the same thing, are probably already saying the same thing online as they should be. And, you know, if you don't believe me, there's a whole host of other people that are going to be able to tell you the same thing and maybe tell you a little bit better than I have. I just feel the need to voice this and get this out there. Underlying all this, not necessarily metal, much more punk, but I got Henry Rollins' Liar playing under all this. And I can't think of a better song to play with this current administration and their medical recommendations. So do me a favor, do the whole like and subscribe thing. It kind of helps me out, not financially, but it just helps me get a little bit more visible out there. And be well, rock on, and we'll see you.
Aceta-WTF.